Hey everyone, Dr. Crocker here. I hope you are having a great night. I am really excited about this Instagram Live with Dr. Sydney. She is an exotics veterinarian, and we are going to talk all about her journey to becoming an exotics veterinarian. And I work on exotics at the emergency clinic, and so I know a little something about it, but definitely not to the level that she does it. So let's see if we can get her on here. I think I said she was. Hi.
Hi, how are you?
Good. Let me adjust so you can actually see my face. It's always.
Oh, it's like so zoomed in. I wasn't expecting it to be.
Yeah, it always like cuts off half of one of the person and the other half of the other person. So I'm always hoping it works out. So how are you?
I'm doing well. How are you?
I am. It's been a busy Sunday. We are moving into an apartment this next week, so we've been furiously trying to get stuff ready, and we decided
No
to
more
head
camper?
today.
No more.
No, we the camper, everything froze during the Great Freeze in Texas. Yeah, and so we moved in with my mom short term, and then someone else actually needed the camper, and so we're like, well, you can use it, and we're gonna get an apartment, hopefully for just the last couple months of our house build. We're like praying.
So exciting. I can't wait to see your house.
It is exciting. I've already picked out like every detail, and now I just need it to happen, like I'm very excited. So, okay, introduce yourself and tell us where you're at, when you graduated, all that fun stuff.
Yeah. So, hi everyone. I'm Dr. Sydney. Dr. Sydney Pokart, but everyone just calls me Dr. Sydney on here.
Yes.
If you work with me in person, then you probably call me Dr. P. But I am a 2016 Western U grad, and I am born and raised in Southern California and stayed here after graduation. So I'm currently practicing in Orange County, which I know you're familiar with, Dr. Crocker. So
Yes.
I probably am going to continue to practice here and stay here. I can't really see myself moving anywhere else unless it was like in the future and I owned a practice here and then started to venture out other places maybe.
I think it's interesting because I grew up in California. I went to fourth, fifth, sixth, and seventh grade there, and then I moved to Texas. So big difference.
Yeah.
And then I went back there for my internship. So I love the weather. I love the food. I love the hiking and all the things.
Mm-hmm.
I hated how much everything cost. Like coming from Texas, it was like sticker shock on everything once I was an adult and actually paying for things. But you can't beat the mountains and the beach and all the things you guys have. It's amazing.
I know. It's hard. I mean, luckily like you're in a great place too. So you have, I mean, it's easier like of a transition, I guess, unless you were to go to like, I don't know, Minnesota, Ohio. I don't know. But
you have to be careful on here because I've like mentioned places before, and then people are like, I live there and I love it, and I'm like, it's fine.
No,
like
it's great there too. I mean, just like climate wise, although like who knew that Texas would have frozen over? So maybe that was huge surprise, but at least, yeah, it's so hard to beat Southern California weather and just like being like, oh, I can just go to the beach after work, or this weekend I want to go snowboarding or something, so I'm just gonna do that. So
look, someone's already
like, hey, Minnesota's great.
I'm telling you, it's like people are spread out, so I'm like, I'm so sorry. Okay. So, no, sorry. It's okay. You're good. Okay, so I mainly have been interviewing people who are like board certified specialists. You are not board certified, but you do work you work on small animals and exotics, correct?
I do, but I would say probably like 60% of my patients are exotics. So there's definitely some days that I don't even see a dog or a cat, and it's super funny. And so I'll be like that for a puppy.
I love your Instagram because I love all the little animals. And after I started working at the emergency clinic and doing exotics, I actually got a bearded dragon that needed to be rehomed. And we love our reptile, and I never thought I would say that. But they do have a lot of personality, and it's fun to see the connection people make with their exotic pets. So do you work on everything? Because let's be clear, there's some exotic people that work on certain, like birds mainly, or rabbits.
Right.
What do you see?
Right. I work on everything. So I basically work on anything that can fit through the door. So if that, even if that means a zebra, then that's fine. So I do have some clients like in the area that have a little bit farther than like the direct area, but zebras, camels, things like that, small ruminants. So I'll work on literally anything. The only thing I would say that my practice, we try to refer out would be like pigs, like pot-bellied pigs, just because of how loud they are.
Yeah.
So my boss doesn't always like having pot-bellied pigs in the hospital, but I'll work on a pig if needed. But yeah, I literally see anything. So I've even seen scorpions, tarantulas, millipedes.
That's like,
oh my gosh, like literally anything.
It's so crazy to me, but I love it, right? I love that people get so attached to all these different types of species and animals. And I'm always impressed by exotic pets, because I think it's hard enough to, like, I started out equine and now I do dogs and cats and like a little exotics, but it's not hardcore. And just knowing like 3 species is difficult enough. But the fact that you have to know so many different things about all the species and the anesthesias and the sedations and the medications, and you can't give this to a guinea pig because you'll kill it, but give it to everything else. It's very, very specialized. So I still consider, even if you're not board certified, I would say you are specialized, because not everyone can just graduate and go and do what you're doing. It is a very specific niche. So let's kind of get into your life and the history. So you went to Western, you're from California. Tell me, when did you get hit with the vet bug? When did you decide that was the route you were going?
Yeah, super cliche, but I was like 4 years old and I got my first vet kit and I was bandaging all my stuffed animals and I was like, I'm going to be a vet one day. And then in high school, I was like, okay, well, I actually need to see if this is something I can legitimately do. So got my first job and it all took off from there. And then in college, I started to get like a really big interest in exotics. And so I started.
Was that through like, you're volunteering, or was that through just like pre-vet stuff?
So some pre-vet stuff. I went to Cal Poly Pomona, so I did equine, cattle, small ruminants, pigs, things like that on campus. And I was like, I also really love exotic animals and exotic pets. I had like frogs growing up and things like that. So lots of little kind of creatures, not really. I did have a hamster and I had pretty much frogs. I would say that's the majority of things, but I still was like, hey, I want to be their vet too. So I started volunteering at the Los Angeles Zoo and then also the Orange County Zoo. And the Orange County Zoo, which now I'm actually one of the vets for also, which was really neat. But so I started as like a little volunteer there, and then I got a job there. And at that zoo, we have basically animals native to the southwestern US. So everything is like wildlife, and a lot of the animals were previously like injured or orphaned wildlife that couldn't be re-released. So they went to like their forever homes there. And so they have a lot of small owls, large owls, reptiles. Even we have a chinchilla that was someone that like just wanted to be able to their chinchilla. We were like, yeah, we'll take it. We have a petting zoo with the goats and sheep. We have mountain lions, bears. So kind of a big, like a range of things.
Yeah,
all
huge
stuff
range.
that I was really passionate about. So I love zoo medicine as well, even though I don't necessarily see myself going, in that path to just be like, I'm just going to work on like gorillas and elephants and giraffes and things like that. That's not really my path, although that is amazing, of course. And I still have worked with some of those species, but I really wanted to do it in more of like a way that I could still incorporate doing small animals and small companion mammals, birds, reptiles, because I just couldn't see myself not seeing like pets, like dogs and cats and things like that too. So
there's a little difference too between like zoo animals that are, for conservation and education and all that, and like people's pets and the relationship that you have with owners. So it sounded like you love the animals you work on, but you also want that relationship with the owners, which I think is, the big difference between private practice and kind of zoo or academia type stuff, which I really like to hear. So you're like shoveling poop and feeding animals, volunteering, right? Like pre-vet.
And then what else did I do? So I was like, I just want to experience like every aspect of vet med. So while I was volunteering at the Orange County Zoo, then a position opened up. So I got a job there. I also was still working on campus with all of the animals. I also was working at a small animal hospital, and I also worked at an animal shelter and in a lab on campus as well, doing research. So I kind of did like way too much all at the same time, but it was manageable somehow at that moment. But then I knew 100%. I was like, this is what I'm doing. This is what I want to do. And so the vet at the time at the zoo is actually my current boss. So I was like, wow, he owns an animal hospital. He sees small animal and exotics. He does wildlife also, because the hospital is actually the wildlife like rehab center for Orange County, or one of them. And I was like, he has the coolest job in the world. Like I wish I could have a job like that one day, thinking that it could never happen.
Yeah.
Yeah. So, I maintained, like I got to know him and everyone else at the zoo and involved in like the vet team, and kept connections with them. And then my 4th year of school, I came back and did a rotation with him basically at his hospital. And also at the zoo. So basically he was going 1 or 2 days a week there. And he was like, talk to me when you graduate. I want to hire you. And I was like, what? You're totally joking. Like there's no way.
Dream. Yeah.
Yeah, there's no way. And then I always knew that I did not want to do an internship. So I was very kind of dead set on that, but only because
that's abnormal for most exotic tracks, right? So let me stop you right there real quick.
Okay.
And let's backtrack a little. Everyone gets excited and start telling the story. And I'm
I know.
no,
oh my God.
We got to get in the details. So you go to apply to vet school. Did you only apply to Western U? Did you get in your first time? What was that like? Did those connections you had made help you with your vet school application?
Yeah, so I did not get in my first time around. I was waitlisted. I did know, however, that Western U was my top choice.
Right.
Not necessarily because I had to stay in the area or anything like that, but the program is something that I really liked and really wanted. So that was definitely my top choice. My connections, I mean, I think that, yes, they were definitely helpful. I mean, I wasn't going in with like a specific track in mind or anything like that. Western U doesn't really have that anyways, but a couple of my mentors also are involved in like the Southern California VMA. And so I did know I had some great letters of recommendation and things like that. But so I was waitlisted my first year, devastated, of course, but it's one of those things that's like, I got into the class that I was meant to be in. I would have been like, there's some of my best friends today. I had the most amazing experience. And then for a year, I got to do other things like strengthen my knowledge with exotics at the zoo and wildlife, and worked at different places and just kind of strengthen my skills and things like that.
Did you in that gap year, like, did you get any feedback on your first application to know what you needed to strengthen? Because I definitely did that. Like A&M was like, you've only done horses, you have no small animal experience. So in my gap year, I did like half horses, and then I went and worked like a little small animal. But you can't, I think people don't know, you can get feedback on your vet school applications usually of like where you need to strengthen it. And then you use that gap year to make yourself a better applicant.
Exactly. It's even though it's scary to ask them, it was one of the best things to do because they really do. They give you the feedback. Mm-hmm. So the admissions office basically was like, we just don't have enough spots, but you can work on your personal statement, strengthening that, and you can work on just getting more experience. Even though I had a ton of like a big range, but I was like, yeah, absolutely. You can never have too much experience prior to that school. So that's what I did. In that year is when I primarily worked at the animal shelter, and I also, what else did I do? I did some like soul searching of just like personal stuff too, because I was like, I have this time. I want to make sure that I get to do things that I want to do just prior to vet school, and having like that 4 years of just studying
hardcore,
all the time. But,
not having any time.
So I felt like I was able to just like as a person grow, and then I also strengthened my personal statement, asked for like an additional letter of recommendation, and then got some extra experience, and then got in the next year. So
for people who aren't familiar with Western U, because I did when I was doing my internship in California, we had a ton of Western students come through. But explain how their program is a little different, because you just said like you don't really track. So how is it set up compared to other vet schools?
So most people know Western U for their PBL system, and that's basically like your entire curriculum first and second year is problem-based learning, and you learn in groups, and you do a lot of self-learning and things like that. So first and second year is pretty traditional, like most other schools, with just mostly on-campus things, and no lectures though, so just all group settings for things with clinical skills mixed in. Then our third year is all clinical things basically. So we do 2-week rotations all year long in different disciplines. So there was like, you do a 2-week equine rotation, 2-week large animal or dairy animal, then beef cattle type thing, 2 weeks of zoo medicine, 2 weeks of small animal GP, 2 weeks of ER. So pretty much everything, including lab animal, basically everything, food, health and safety, public health, things like that. And then fourth year, you get to pick essentially the entire year, anywhere in the world that you want to go, with the exception of internal medicine and surgery are somewhat selected for you. You get to kind of choose preferences, but there is no small animal, large animal track, except for with internal medicine and surgery, you can choose to do large or small animal of those. And then you kind of request an area of California, and then they still place you kind of randomly
somewhere. So you were doing exotics. So your fourth year, where did you visit? What type of places did you go? I mean, you knew that's what you wanted to do. Like it was solidified, right? And you were good to go.
So I wanted to still have a really strong small animal foundation, obviously, since I still wanted to do that. Had I wanted to go maybe into like just zoo medicine, for example, I might have chosen more large animal rotations, because you do a ton of like ruminants and things like that in zoo medicine as well. But so I chose to do a lot of small animal rotations mixed with exotics. So I did emergency and critical care, my internal medicine, surgery. I did a mixed animal practice in Oregon. I did a shelter rotation, which was amazing. That's what gets you the most surgical experience ever. So I know a lot of students think, oh, on surgery, I'll get surgery, but no, you won't.
No.
You're like the lowest on the totem pole. Yes, you will watch everything.
You sit there like, okay.
Yeah. Exactly. So my surgery rotation, my shelter rotation, I was in San Jose, California, and they did exotics a little bit there. So that's where I learned to spay and neuter rabbits, as well as dogs and cats, and then do a little bit of like guinea pig, wildlife kind of thrown in there. I also did a rotation at my current practice. And then I did a rotation with an exotics or an avian specialist in Calabasas, California, who also saw other exotics and small animal. And then I also went to the Johannesburg Zoo in South Africa and did zoo and wild.
There.
You have?
Yes, I did a big mission in South Africa for like a month, and it was like the most incredible. We were in Johannesburg, and it was the most incredible experience ever.
Awesome.
Yeah,
I loved it.
Amazing. I know. I want the world to open up again so I can like show my children the world. But yeah, it was a pretty life-changing experience, and just a recognition of how. Sorry, this is like a tangent, but how. I mean, really how kind of blessed we are to be born where we are and what we have. And it was a lot. But we should have a glass of wine and talk about that another.
Yeah, definitely.
But
yeah. And then the only other things I did were dermatology, which I loved so much. And you see so much of that in small animal GP and even exotics too. And dentistry. Got to throw this in there for any of our, I mean, like maybe Toothy Thompson and the derm vet are listening in.
Yes, I did. Ashley was on here for a second. I don't know if she's still on here. She has kid bedtime. So, okay. So what I find really interesting is that I've actually met more and more like general practicing exotic veterinarians. And I think in school, I always felt like that had to be like a specialty. You had to do an internship and you had to do more. But that's really not the case. Do you feel like that's true also, that there are a lot more kind of, because someone asked on here, like, can you do small animal and exotics general practice? And that's basically what you do, right?
Yeah, absolutely. You definitely can do this without specializing. But with that said, I think that, and I know that you definitely have to have great mentorship. I wouldn't necessarily suggest someone coming out of school to just be like, I'm going to try exotics all on my own. Right. I definitely owe so much of my knowledge to my mentor, my current boss. And, you know, I definitely wouldn't be where I'm at right now without that mentorship.
So when you graduate, I'm sorry.
Oh no, I was just saying, yeah, you definitely need that. You have to have some kind of, whether it be a formal program to specialize or just some great mentorship. My boss has been doing it for like over 30 years working with exotics. So I think really the only reason he's not boarded is because he's like, has been doing it so long that like, why is he boarded now? But so a lot of people actually do think he's a specialist, and they think all of us are, because we all see exotics at my practice, but we're not. But I am actually thinking about becoming, or doing the like alternate type track of becoming boarded in small companion mammals or small exotic mammals. Maybe. I'm thinking about it because now I'm almost 5 years out of practice or in practice. So now I'm actually eligible to become, like, to do that kind of thing. So maybe.
Yeah, I do like that. You know, I feel like a lot of people feel like they have to get an internship to be good or have that mentorship. And I am like, no. Like, you don't have to go get paid like $20,000 and work ridiculous hours. Like, you really can find a good practice with good mentorship and someone who really wants to help you and still grow and become a great practitioner without doing an internship. And I have more students asking that right now, I think because of COVID and them feeling like they haven't gotten enough hands-on, so they need to do an internship. And I'm like, if you go to a good, strong practice, you're still going to get what you need in the long run. Right. And so that's basically what you've done, which is great. So you graduate and you go and start working with him. Was there like a gradual, because even if you had learned a lot and worked with a lot of animals, I still feel like exotics is a huge, huge amount of information and things. So did you jump right into like doing surgery and doing all the things, or did you kind of have a gradual progression to it, or how did that kind of work at your practice?
Yeah. So for the first 3 months, I primarily did just dog, cat, and exotic companion mammal appointments. So like rabbits, guinea pigs, hamsters, ferrets, chinchillas, things like that. And I would see still like birds and reptiles here and there, just usually with my boss or with one of the other doctors. We kind of had like a either 3 to 6 month trial period of like, or not trial, but just kind of ease my way in type of period. Right. After the 3 months, I felt really comfortable with everything. Of course, I didn't know everything and there was still a lot of stuff, but I felt really comfortable. So my boss was like, okay, then you're free to see any exotic you want. And I did. And then anything that needed surgery or needed anything more complex, then he just did it with me, or he watched as I did it. So even my first year out, I was doing surgeries on birds and reptiles. And so, but that was definitely where my comfort level was. We've had other associates that have, things have been a little bit different, or maybe it's not been exactly 3 months. Maybe it's been a little bit longer, a little bit shorter, things like that. So it definitely just really depended on my comfort. But that was basically kind of the plan, was like, let's go 3 months and then reevaluate and then go from there. But yeah, I was pretty much doing things day one.
But what I like is you guys had a discussion in the beginning of what you both kind of, how you saw it going, and then you also said, let's try this and let's see if you feel like you're getting what you need, and reassess. And I think that that's the most important thing, because a lot of times you join a practice and there's an understanding of what mentorship is going to be like in your head, and then there's understanding in their head. But if you don't like communicate and verbalize it, it doesn't always happen. And so kind of saying like, I feel comfortable with this, but I really want a little extra help with this, or voicing that, I think, is one of the best things you can do as a new associate. Did you feel like you had to do more like CE, or was it more on the job learning, or was it just knowing where to find the answer? Because I tell students, you don't have to know everything, but you do need to know like where you can find the answer,
Absolutely. I think that I feel like the majority of my experience has come from just on the job training. And definitely the resources as well. I have some great ones that I love that I am definitely going to share with everyone too. But that definitely is what helps me the most. CE, it really depends. So at a lot of the conferences, there are some really great CEs, and especially at Exotics Con, which is like exotics only. So I would say those help you a lot more than just maybe the Western Vet Conference or any other ones, because they do like hands-on labs with exotics versus more of just like some of the talks can be a little bit basic depending on where your comfort level's at. But if you are just starting off, they definitely are really helpful at any conference. But majority of my knowledge, experience, just everything that I learned was really on the job. And we see a really high caseload of exotics, and we get a lot of, there's maybe 2 or 3 other hospitals in Orange County primarily that see a lot of exotics, but they refer a lot to us. And vice versa. So we have always gotten a pretty high caseload of things. So I have been able to get exposed to so many different ranges of medicine and surgery of all exotics, like right off the bat.
Do you think that part of that though is like a testament to your maybe personality of like, I'm going to jump in, I'm going to try this, like I want to learn? Because I do think, some personalities need that extra, encouragement, hand holding, whereas I did an internship, and my internship, basically, I was like, I want you to let me do everything and try everything. I don't want to watch you. I just want to get in there and do it. And then I want you there in case I need you. But I really didn't need anybody pushing me. I was like throwing myself at stuff. Does that make sense? And it sounds like you're kind of similar.
100%. I was going to say, like, yes, we're the same with that. And it doesn't mean that if you're not like that, that you can't learn and progress and everything. But I do think, without sounding like egotistical or anything, it's like, I had such a desire to get in and really jump in, and I was confident in myself with where I was at, and I knew where my limits were. I knew when to be like, I need help with this. I'm not going to try to tackle that on my own. Especially working with species, like some of which even still today that I'm like, oh, what's that again?
Yeah.
I have to do my research sometimes before appointments, but so yeah, you definitely being able to jump in like that is helpful. It makes you, I don't know, kind of the transition smoother too sometimes, but.
I think so. I think realizing that you need to be brave. You're going to make mistakes, but you'll make those mistakes either way.
Exactly.
So to me, like just get it over with. Just do things, learn, as fast as you can versus like sitting back and being scared to ever make the mistakes. If that makes sense.
I tell students that actually, I'm like, you are going to make a mistake. Like there is no question about it. No one is perfect. You are going to make that mistake that person has made and that person and just don't be afraid to, like, if you hold yourself back, then you're not going to grow as much if you're just too afraid to make those decisions. So, yeah. So
this was one of the more common questions. I know you probably get this all the time, but do you have a species that's like your favorite to see or your favorite to work on? Because I know some exotic vets that like love birds, and then some that love reptiles, and some that love turtles. So do you have, where do you lay there?
Yeah. So another reason also that I wanted to get into exotics too, when I was at the Orange County Zoo, I absolutely fell in love with owls. And I was like, they're my favorite thing in the whole world. And so I was like, I have to work with owls. I have to be a vet to owls. And so that is one of my top favorite species. And I know that's like so like narrowed down, but not just wildlife. We actually have a lot of clients that are falconers. So they bring in the
okay. Yeah.
Aside from that, though, I am really passionate about the exotic companion mammals. So I love birds, I love reptiles, but I'm like, I don't know, I have this like special spot for like all of the exotic companion mammals. And maybe that's just because I think a lot of my clients, oh my gosh, lots of owls in Minnesota.
I was just reading that. Like, don't you never Minnesota down. All the Minnesota owls just heard you say.
I know. Oh my gosh.
That's so funny.
I think that like we were talking about earlier, just that bond that you can have with your pets and things like that. I love that, and I love being able to teach owners that like, yeah, you can, like, these creatures they can just be very similar to your dog and cat. They do have really great personalities. And I do see just a lot of rabbits and guinea pigs, honestly. So I've kind of gained a little special sweet spot for them, as well as hamsters. I show a lot of hamsters on my Instagram. So,
I mean, they're pretty cute. I have to admit, like, they're adorable. So I work ER relief, and so I only do it a couple times a month, but we see exotic emergencies. And what I found quickly is certain exotics get certain emergencies, and as long as I know those like few things that are really common in those species, then I'm good. But I could not do, I mean, all the husbandry for all of the different exotics, that's next level to me. And I think a lot of that comes with all the experience that you did, and all the training you did even before school, because the husbandry side of it is a really big part of being an exotics veterinarian, right?
Absolutely. 90% of the issues I see are related to husbandry. So absolutely. It's the most important thing, probably.
Do you have a preference on like surgery versus medicine? And what's the coolest surgery you've done?
I love surgery.
Yeah.
Surgery is my preference. The coolest surgery I've done, I have like top two that I am always torn between. So the first one is that I have spayed a binturong, and some people may not know what that is. So look it up. It's also known as a bear cat. And they have this like funny odor to them, and it smells like buttered popcorn. And just because it's such a unique species, I was like, I spayed a binturong. That's amazing.
Yeah. Really cool.
But my other thing, which probably is a little bit cooler, is that I had a blue tongue skink patient that the owner had recently got, and it was like ADR, basically, like off food, lethargic, things like that. When we x-rayed it, it seemed like it had some kind of calcified mass or something in its abdomen or in its coelomic cavity. So maybe in its GI, most likely. Because she was clinically not doing well, I was like, we need to go in surgically for her. And when I did, I actually found 2 babies, and they were alive. So they're one of the few exotic or reptiles that have live births. They don't lay eggs. And so I went in there and I was like, oh my gosh, there's 2 babies in here. Like, I was not expecting that whatsoever. I couldn't make out on the x-ray that those were the calcified things were their
babies.
Skeletons.
Yeah.
And so I start removing them, and they both opened their eyes mid-surgery at me. And I'm like, my technician yelled for our other colleague to be like, get in here. So I basically like passed her off the babies, and she, warmed them up like little puppies. And so my exploratory skink surgery turned into a C-section.
C-section.
Yeah.
Oh my gosh. That's
super
crazy.
random, but it was one of the coolest things ever.
That is very cool. Well, and they're so hard to anesthetize, so I would imagine that the babies probably weren't getting much anesthesia. So probably,
no, they were not. They were fully awake.
At least they were alive, so that's awesome.
I know.
Okay, so you, your daily schedule, you see exotics and dogs and cats. How many days a week do you work? What's your length of time you work? I had somebody ask on a private chat what you feel like your work-life balance is. Do you feel like it's better or different than general practicing small animal veterinarians?
Yeah, so I definitely, when I started off, I feel like most people worked many hours, and my work-life balance was very poor.
Yes.
Until I realized, I cannot keep overworking myself, and I was burnt out and very quickly. So I didn't want to have to give up though exotics. I wanted to try to come to something that worked for me as well as the practice and stay there. So now, luckily, once my schedule changed, so I work Wednesday, Thursday, Friday, full days, basically 10, 11-hour shifts. And then I work a half day on Saturday. And then in between, sometimes I do relief at other places as well, just because, I don't know, I guess I like to I still want to learn everything. I still want to, I like seeing other experiences and other practices. And my boss is really, really cool about me doing relief and things like that. So I do that here and there. So, and then I also just started a teaching job. So I'm teaching surgery. I
saw that. I was like, wait, what?
Yeah. So I'm teaching that 1 day a week at a local RVT school. So we actually work with that school really closely, my practice. So my boss let me do a split shift on Wednesdays. So I basically work Wednesday mornings and then go teach Wednesday afternoons for now. Yeah. So on Wednesday, Thursday, Friday, my normal routine is that my mornings are surgeries, my afternoons are appointments. So only myself and my boss do surgeries. The other 2 associates that we have don't like to do surgery. So they don't. And I'm like, great, more for me. I love surgery.
Yeah,
so
usually
my days are spays, neuters, dogs, cats, rabbits, guinea pigs, are the kind of the majority of surgeries I do. And then I'm doing, I have a bird mass removal next week. I'll do egg removals on tortoises. And then my afternoons are appointments, and then Saturdays appointments as well. But we also see walk-ins, emergencies, pretty much anything.
Okay, wait. Do you do your egg removals? Do you cut the shell, or do you do the little in the leg opening?
Yeah, so both. It depends.
Okay.
It depends sometimes on the species of tortoise, but I've done both ways.
See, I do know something about exotics.
Oh,
it's only because Dr. Thielen is my friend and I hang out with her, and yes,
awesome.
she has taught me a lot, and that is it. So thanks to her. So let's go back to you teach, which is great. I think bringing up technicians is really important when it comes to exotics, because I would tell you I would not survive at the ER when I work on exotics without technicians who know how to handle these patients, how to safely restrain them. I don't do any of that. I mean, they hold them, they know a lot more of the husbandry even than I do. And some of them are so good at their jobs. Do you feel like you have a really great support staff and team, and that's one of the reasons that you've been successful?
Absolutely. My team is excellent. We have, and a lot of them have come in with not a lot of exotics experience, but also that like passion and desire. So because myself and the other doctors, we have so much hands-on, like even just husbandry, restraint, things like that. We make a point to teach. We teach a lot, just even during like practice, restraints. One technician that I work with primarily, I've taught her how to give injections on basically any species, draw blood on every species, things like that. So I think in the beginning, it was a lot of like all the doctors pretty much were doing everything technical on the exotics, because some people are not as comfortable with that. Right. But now we've definitely gotten to a point where I can be like, okay, we're doing a spay on a bird. Go ahead and prep it just like you would a dog. And I'm
a dog or cat.
Yeah. And I'm here, but they can do it on their own.
Which is awesome. I mean, that makes you more efficient. It makes the practice more money. I mean, having your staff and taking the time to train them and then trusting them to do the job is huge. And I feel like, this is another tangent, but I feel like veterinarians that have good support staff that they can trust and they can do veterinary things and not technical things, it really helps also with burnout and things like that, because I have other things I need to worry about, and I don't want to worry about placing the catheter, and I can do all those things, and sometimes they call me because they can't get it done, but a majority of the time I do the states. I say, here's the anesthesia plan, I got to go in the office, I got to make phone calls, I have 20 other things to do, and then they call me and say, patient's in there ready, you just got to gown and glove up and let's get it done.
Absolutely. It's really nice to be able to do that, because I can be like, okay, place that catheter in the rabbit and intubate it. We also intubate rabbits. I know a lot of people don't, but and it's nice because they know how to do that, or intubate the bird, place the catheter in that. It is really nice to be able to do that, and them knowing that I'm always obviously still there on standby. But a lot of them have been comfortable to be able to get to that point. Absolutely. If they weren't, I would never, force them to do any of that. But I think it's important that they be able to learn that stuff too, because it's all technical stuff that they should be doing. It doesn't mean that I have to do everything.
Right. The bird thing terrifies me. The birds scare me. I know. My grandma had some 40-year-old parrots that would always attack us every time we went to her house. So I think I have PTSD when it comes to birds. But if I have a good technician helping me and restraining, then I can get anything done I need to on a bird. So for me, I cannot express enough how much I love my technical staff and help with the exotics and small animals, obviously. So you're obviously happy and passionate about what you are doing. I know that there's always good and bad things. So what are some of the maybe difficult things, or what are some of the bad things with exotics? I feel like everything's dying when I see it, but I work at the ER, so
yeah. What do you think? I think that that's one of the biggest things, is that many clients have obtained a lot of their pets from PetSmart or Petco, where unfortunately the husbandry is not the best, or maybe the source of where they obtained those animals isn't the best, and not necessarily to any fault of the employees that work there that are really trying hard, because I do see a lot of Petco and PetSmart animals as well. And it's more of like a corporate issue, but I have clients that come in that have no idea how to take care of their exotic animal, and they are coming in half dead, and it's heartbreaking. And so that's probably the biggest negative, I would say. That, and also then, okay, I'm going to teach you all about husbandry, but also let's come up with this treatment plan for your animal, and here's the bill, or here's the estimate. And I'm not going to pay that. I only paid $20 for this animal. Right. Why would I pay even $200 for anything? Right. So that's the hard part. A lot of exotic pets, unfortunately, don't get the treatment, or, we have to do what's right for the animal to not allow it to suffer. But that may not mean going forward with a treatment plan to try to keep it alive. So that's probably the downside of things. I think that many of us that work with exotics are really passionate also about educating the public on how to take care of their animals, and trying to work with pet stores or other groups to make sure that every client that comes in, or every patron that comes in wanting to purchase an animal, knows exactly what that animal needs as well. Yeah.
And I mean, I'll be honest, when I got my bearded dragon, I was like, tell me exactly what to do, how to do this, what I need. And I read a ton of books, because it's a huge learning curve, the husbandry side of it. And you really have to be prepared for that. I think that's important for people to realize, that even though these animals, it's really cute and, you help a lot of them, I feel like I do have a lot more euthanasias of exotics than other species. And it is entirely the reason that you just said, which is really sad and difficult. But on the flip side, bird owners are like obsessed with their birds and will do everything. Even when I'm like, this is not going to work, your bird is laying on the ground gasping, and they're like, I need you to save it. Like, this is I'm like, I can't save it.
You are not wrong. That is definitely true.
It's so funny how there's very specific things, no matter where you work, that I think you experience. So, and then overall, is there anything you would have changed about like your choices or the path that you took? Is there anything that would have made it easier? I mean, it sounds to me like you did have a fairly linear path, which is surprising, compared to most people I've talked to. So
yeah, I feel like I just got really lucky with my path. I wouldn't change anything. I'm completely happy and satisfied with everything that I've done to get me to this point. I love what I do. I love everywhere that I've been, and I wouldn't change anything. But I guess I did have a pretty linear path. I really do. I just feel like I lucked out. I still sometimes am like, I can't believe like I'm actually here, thinking like for, gosh, like almost 10 years, I was like, I want to do that job, but there's no way I could ever do that.
Right. And then you did it. But let's not put aside all the experience you got connecting early on, and like showing that you were a hard worker, that you wanted to learn, that you had passion and drive. Like, it didn't just fall in your lap. You definitely, you were going for it, And so I think that makes a huge difference. And I like that you are doing other things too, and you're doing the teaching, and you're kind of like, I think it's important in our career. We can love what we do. We can absolutely love it, but you can have kind of life stage changes and things that happen where you say, but it's not quite working for me like it did before. So like, what can I do to make it better? Can I change my schedule? Do I need to do something different? Can I challenge myself in a new way? And it sounds like that's kind of one thing you've done recently.
Yeah, it's funny because you go through pre-vet and vet school, and you're like, the end goal is just to become a vet. And I thought that I would just be like, yep, I'm completely satisfied and happy, and just, that's it. This is what I'm going to do forever. And then I realized, a couple years in, like, but what's my next goal? Like, what's the next challenge? And I think that's why I still, like, I do relief, or I still want to get other experiences too, because I'm like, I don't know, we're all very similar type people, right, as veterinarians. So I feel like there must be another goal.
Yeah, no, I think that it's important to not get stuck, and it's important to continue to find things that make us passionate and make us happy. And some of those things are in vet med. I would say most of my things are still veterinary related that I really love to do, and that's okay. And then some people find things outside of, vet med that fill their cup. So yeah. I think it's good. I am definitely going to come hang out with you in California.
Yay.
And we're going to have like a snout squad get together. Danielle's promised me at some point.
Yeah.
Or I'm just going to come hang out, at your house and then follow you to work and
yeah.
and all
get you comfortable with bird restraint.
Yeah.
We're going to do it.
No. I'm like sweating thinking about it. Please don't do it.
It's so funny. I saw a bird the other day and she like gave me kisses on my cheek, or like I'd be like that, and she would just like come right at me and give me kisses. And it was so sweet, and everyone was like, oh my gosh, get it away from me. And I'm like, no, I promise this bird is like so sweet. So I always try to like pick those ones out to be like, here, practice on this bird because she's so sweet.
I'm very comfortable with my bird association. I can do an exam when they're restrained. I do not need to kiss and make out with them because it freaks me out. Leslie said she's a little late. She wants to know where we studied and did exotic vet med. So if you want to reiterate where you studied, and then also where people can connect with you further if they have more questions or if they want to follow up.
Yeah, absolutely. So I went to Western U for vet school and currently practice in Southern California. My practice is called Serrano Animal and Bird Hospital. And so you can always look me up there too, but you can find me primarily on Instagram. I would say that's the easiest way to get a hold of me and talk about anything. So at Dr. Sydney spelled out and then _DVM. I also have a website, which is just www.drsydneydvm.com. So those are the best ways to connect with me. And then let's see, Leslie, in regards to just other training, I really got a lot of it on the job. I think we were talking a little bit earlier, but when I was saying, I knew the internship route wasn't for me, but just mostly because I'm in Southern California and it's very expensive and I couldn't survive on an intern salary because I had no other financial support. So that was like the bulk of my decision.
Which is a valid, that's a valid reason, right? Like that's important to understand that if you do an internship, you're going to work ridiculous hours. And I think I made $30,000 at mine in Southern California, and that's because of Southern California. If I'd gone anywhere else, I probably would have made 20 or 25. Yeah. So, but I was married and had a husband, and he had a great job, and it gave me a lot more freedom, So I think that does make a huge difference. And you guys should definitely be following her on Instagram and go to her website, because she's got really great knowledge and information, and she may have things coming soon that will be awesome that you need to invest in. So I'm not going to have any spoilers. We'll just do a teaser, but Dr. Sydney is brilliant. And I'm really, really, really thankful that you shared your story, because I did not know all this. And it is fun to find out kind of people's backgrounds and see their passion and just hear about where they're going in vet med. So I appreciate you coming on.
Thank you so much for having me. This was awesome.
It was like kind of last minute. So I appreciate you like being willing to jump on it and do it. So
I appreciate you for being able to do this. This is awesome. And all of your career talks are amazing. I'm so glad that you're doing all of that. Honestly, I learned so much from everyone.
I know. Well, I have too, because I really didn't know since I didn't specialize, I didn't know about a lot of these things. And then it's been really cool to learn more and then be able to hopefully help, students and younger vets with it. So I really just enjoy doing it, which I feel like I'm a total nerd for saying that, but I like talking about veterinary medicine. So.
Yeah.
All right. Thanks everybody for watching. If you need either of us, reach out to us on Instagram, and Dr. Sydney, you're the best. I'm definitely going to come hang out with you. We need to tell Danielle she's got to get on that. So
Absolutely.
All right. I'll talk to you later. Bye.
Bye.